Hi friends, welcome to my channel and welcome to this part of my world. Thank you so much for stopping by. So my name is Joyce and I am a physician associate and I work in general practice. So today I am going to talk to you guys about angina. So basically, angina is when there is interruption or there is reduction of blood flow to the heart, which then causes the symptoms. So with angina, the main one is a chest pain. So it will be a chest pain which is usually associated with exertion. So when you're walking up the stairs or just running or that kind of thing would result in you having a chest pain. And that chest pain can also be associated with nausea, sweating, and tiredness. So most people would describe that chest pain as chest tightening, or sometimes they would say there's a squeezing feeling that they have, and it tends to actually be it travels onto the neck and also the back and the arm as well sometimes. So there is also shortness of breath with association with this chest pain. And the shortness of breath, again, the key thing with this chest pain is it doesn't usually, or it wouldn't happen at rest. It's always to do with when you have had exertion, when you've been running, jogging, going up the stairs. And the pain itself is very short-lived. You would find that when you stop whatever you've been doing, then that chest pain would stop. So it usually would stop within minutes and then it's gone. And then if you exert yourself again, it would come back. So what are the risk factors, or what is it that makes you prone to having angina? One of the key risk factors with angina is smoking. The other one is if you are someone who already has high blood pressure, if you are someone who has high cholesterol, especially if you have high cholesterol and it's not being well controlled. It could be that you're not on any medication, or you are on medication but your cholesterol is still high, because what happens is the fatty deposits, or the cholesterol fatty deposits, actually go and line on the artery that is supposed to, where the blood is meant to be flowing, and that reduces the blood flow to the heart. The other thing is if you are obese, so that obviously then is also associated with high cholesterol and other problems. If you're someone who is diabetic, that's another risk factor. As we have talked before with regards to the diabetes opens up a lot of other problems or health problems. So definitely angina is one other thing that is very much associated with diabetes. Having stress is another risk factor for angina. And if there is a family history of heart disease, cholesterol, those kinds of things, then again it opens you up to the risk of having angina. There are two different types of angina. There is stable angina and unstable angina. So the stable angina is the one that I've actually described earlier, where it has a trigger. So it's triggered by you going up the stairs, running, exerting yourself. But with unstable angina, those symptoms come anytime. It doesn't matter whether you're sitting or you're doing nothing at all. Those symptoms come. That one is the most sinister, actually, the unstable angina, because it's unpredictable. The stable angina is the most common type. What happens if you are suspected to have angina? So you would come and talk about the chest pain and all that stuff. So what your practitioner would say, your health practitioner would do, is likely to start you, depending on the guidance in whatever country you are and also whatever region you are in. But for us in the UK, mostly we would start you on GTN spray. So it's a spray, a nighted spray that we can start you on pending investigations. The other thing that your practitioner might consider is to start you on 75 milligrams once daily of aspirin. Again, those two things are trying to reduce the likelihood of you having that obstruction or reduction in your blood flow. So all these things can be done while you're pending investigation. It depends on where you've presented. So if you've gone into hospitals, you're likely to have all those things done anyway, all those investigations done, which would be an ECG, blood tests, and other things depending on what they find. There are specific things that they would find on an ECG which would confirm to your practitioner whether you do have angina or not. And they would also want to exclude any other sinister things with regards to your heart. They might consider even a chest x-ray if they're not sure what's causing your chest pain. So I do hope that this has been helpful. If you are someone who has been having a chest pain, and the chest pain is going down to your arm, to your neck, to your back, and that chest pain is short-lived, so I'm talking of a matter of minutes and then it goes, please do see your GP just to make sure that nothing else is going on. By GP, I mean your general practitioner, your doctor, your physician associate, your nurse practitioner, whoever it is. Right. I hope this has been helpful. If you do have any questions, please share, but ultimately you need to be seen by your health professional so that they can give you a conclusive diagnosis. Take care, and I'll see you on another one. If this has been helpful to you and you think it will be helpful to someone else, then make sure you share, like, and subscribe. Take care. See you soon. Bye-bye.